MedTel have an integrated network of centres throughout the UK, offering quick access to private professional medical advice, diagnostic imaging and surgical procedures.
Hello there. Now, if you're watching this, it's probably because you're booked in to have an MRI scan. The good news for you is that MedTel are letting me go along and have a scan. So we're kind of going to go through this together. I'll let you know step by step exactly what happens. Now, personally, I've never had one of these before. I'm a little bit nervous, but also looking forward to seeing what it all entails. So better get going. Don't want to be late for my appointment.
MedTel offers a full range of diagnostic scanning services, including MRI, X-ray, CT and ultrasound. With premium facilities and state-of-the-art technology, supported by a highly qualified team with a passion for service, MedTel offer excellence in patient care and the peace of mind of a fast diagnosis. So it's no surprise that overall, 99% of patients who visit MedTel would recommend them.
Hello, welcome to MedTel.
Thanks, I'm here for an MRI scan. Well, here I am with Dr. Simon Blease. Now, Dr. Blease, you're going to hopefully tell me all about the more technical side of the MRI. So can I just ask you first of all, what exactly is an MRI? What's the difference between that kind of scan and, say, a traditional X-ray?
And the main reason we developed MRI scanners is because we don't use X-rays, which are harmful ionising radiation. So really it's just a giant magnet, and we introduce a radio wave which gives a signal that comes from the human body that we can detect.
So actually there's no radiation, no danger?
No ionising radiation. It's what's called non-ionising. I mean, we sit completely surrounded by radio waves passing through our bodies the whole time. We sit in the magnetic field of the planet. So these are natural phenomena which don't cause us harm, and we've harnessed those and focused them into a machine that can make images.
Wow. Can we talk about the different parts of the body that can be MRI'd, and also, like, does it affect how you go into the machine? Say I'm having my leg done, how would that be different to from having my head done?
All parts of the body are amenable to being scanned, and what we try to do, particularly with the way that MedTel scans patients with the different types of magnets we have, is to introduce the patients into the magnet in the most friendly way possible. So if you're having your foot scanned, you just go in foot first.
And you're using a different magnet for each different part of the body, are you?
There are different types of magnets, but in general, the magnets are designed for different patient acceptability rather than for different types of the body areas.
I'm quite scared of actually going into the machine. I'm also scared, just in case you find anything. I know that sounds silly, but it petrifies me.
To address the first one, I'd say that we've now in this country got 10 years worth of experience of handling patients who feel exactly like you're describing. They're very afraid of what might happen to them. Because we work with predominantly open scanners, our staff get very experienced in dealing with that type of people. So even if we do put them through a conventional scanner, they've got more experience than the regular radiographers might have in terms of handling that kind of fear of going into the scanner. We collect patient satisfaction data and we review it on a regular basis to make sure that we're staying up to our expected performance on that. To address the second point about the concern of what you might find, our general sort of experience on that is that that's a perfectly natural reaction, and that once the scan's been done, patients actually feel relieved that they've undergone it. Yeah. It's a common denominator, I think, for any medical test. There's an anticipation of what the test might find, and then a relief afterwards that at least the test has been done, and whether it's found good or bad, you can then go on to the next stage of your treatment pathway. So we generally try to help people through that.
You've actually made me feel a bit more confident. I'm feeling a bit calmer now about my scan, so thank you. Lovely to meet you.
Thank you very much.
Hello, Nicola Bond.
Hiya.
Hello, hi, I'm Santhi, the radiographer.
Nice to meet you.
Hello, you too. I'm going to take you down to do your scan.
Okay.
You filled out these for me. Bring your bag and we'll go through these downstairs. All right,
thanks.
Come this way.
Do you mind just explaining kind of what I've had to fill out there, Santhi?
Sure, of course. Have you had an MR before?
No,
firstly?
never.
Okay, well, MRI is a huge big magnet that's got a tunnel in the middle, and the tunnel has openings at either ends, and depending on what we scan, that has to go in the middle of the tunnel. All right. So because it's a big magnet, there obviously could be some dangers involved if you've got metal inside your body. So we give this form for everybody to fill out to check that it's safe for you to go inside the scanner.
If I've got fillings and things like that, is that all right?
Absolutely fine. There are certain metals that are fine to go in the scanner and some that aren't, which is why I will go through this with you one by one to check that it's all right for you to go on in.
Okay.
All right. Now, I've been asked to scan your knee.
Yes.
So you're going to be going feet first into the scanner.
Okay.
So from the waist upwards, you'll be out of it. I'm going to put a cage around your knee as well, and what that does, it keeps your knee very, very still, and it also reads the information that the cells let off to produce the pictures. Okay? It's ever so noisy. It's a bit like a pneumatic drill that goes off intermittently. So I'll give you some earphones and play you some dodgy music, and you can just lie there and relax, okay?
Yeah.
Yeah. And I do give you a buzzer to hold. So if you want to get my attention, press the buzzer and I'll stop the scan at any time.
Any fears I've had have subsided a bit because Xanthi's told me everything that I need to expect. First thing is the whole segment thing, that the scan's going to be in different segments. So if I get a bit nervous, I can stop when I need to. The buzzer, I like that idea, that if I need to, I can chat to Xanthi during it. And also I've got my ABBA CD and I can have a friend in if I want, although I think I'm going to be brave and do it on my own. By the way, I've got to show you these. Look at these. I've got to wear they're about double my size, but very cosy. Got my CD. I'll see you in there.
When being scanned in a standard MRI scanner, the position in which you will go in will vary. The area of your body being scanned will be in the middle of the tunnel. You will either enter the tunnel head first or feet first. If you're having a knee or lower leg scanned, you'll enter the scanner feet first and only need to go in as far as your waist. With a scan on any part of your spine, you'll enter the scanner head first with your feet out of the scanner. You'll lay on your front in a Superman position to have your wrist or hand scanned. And for a head scan, the top half of your body will be in the MRI scanner. For all scans, except spines, a coil will be placed over the area being scanned.
Okay, so just going to set up for the next scan now. I've got my 3 different images so that I can ensure that I get it the correct angle on all the images. The knee's got lots of ligaments in it. And on these pictures we've got lots of different colours, and we can tell what something is by the colour of it, whether it's bone or whether it's fluid. You okay there?
Yeah, you done?
Yes, we are.
Okay, well, it's all done. I've had the MRI, and I'm going to be honest with you, I was really apprehensive beforehand, and now I just can't believe it was a real breeze. I didn't feel closed in, I felt relaxed, I had my headphones on, and they actually blocked out most of the noise. It was absolutely fine, and I think one of the reasons I felt apprehensive today is because years ago, my best friend had a scan, and just before I came, she said, oh, you're going to be really nervous, but actually, things have obviously changed, and coming here has just shown me that it is easy. It's easy, it's fine, you don't feel stressed at all. So if anyone I know feels ill, needs a scan, I'm going to say come here. Definitely recommend this place, and you honestly don't need to worry, because if I can do it, anyone can.
Hello,
Hiya.
you okay?
Yes, thank you.
Excellent. Pictures from my point of view are all fine. It's going to be looked at by one of our consultants in the next 48 hours, and then that will be faxed to your consultant who referred you. Okay? Your pictures are on this CD. Remember to take those with you when you go and see your consultant. You can just pop them in the computer, your name will appear, and then you can see all the pictures, and there's a little leaflet there on how to use it.
Brilliant.
All right.
Oh, thank you.
There we
Thanks
go.
a lot,
You're very
Xanthi.
welcome. Take
okay,
care.
bye.
Bye-bye.
Well, that's the end of my patient journey. For me, the staff here were really, really lovely. They made me feel so relaxed. I was really nervous to begin with, but by the end of it, my mind had been put totally at ease. And most importantly, I really hope this video helps put your mind at ease too. Hope it goes well, and I'll see you soon.
To find out more, contact our central bookings team at 27 Harley Street, London. Phone 0800 028 2288. Visit www.medtel.co.uk or email inquiries@medtel.co.uk.